Hi, this is Dr. Mitchell Yass, and in this video, I want to try to present the amazing benefits that can be achieved through the use of the Yass method. And in this particular case, this is an astounding situation in which this woman was able to achieve, as it says right here, 98% pain resolution in one treatment. Now, I often talk about the incredible value of the Yass method and how it works in terms of interpreting the body's presentation of symptoms to understand what tissue's in distress, to then be able to perform an intervention to resolve the distress of that tissue, thereby ending its need to elicit the symptoms, and then pain ceases. So the key to that ability is to understand what tissue is in distress. And as I've presented over the past 30 years, in more than 98% of cases, the cause of pain is muscular. The problem is that muscular causes do not show up on diagnostic tests like x-rays or MRIs, and there is no medical specialty educated or trained to identify them, which is why chronic pain exists. Chronic pain is the byproduct of misdiagnosis. You are using a method of diagnostic testing, which can only find structural variations. And since in more than 98% of cases, the cause of pain is muscular, these muscular causes do not show up. And so you continue to treat the wrong tissue and you continue to try to live your life. And as a result, the muscles continue to weaken, continuing to elicit pain, ergo chronic pain. So I thought that this would be a great example to show, because one of the things you want to recognize is that if in fact the tissue in distress is muscle, that in fact the tissue eliciting your pain is muscle, that there would also be a correlative change in posture. Posture is the culmination of the pulls of muscles. And so if a muscle is eliciting pain, there is a high probability to weakness or imbalance associated with the creation of the pain, that you would also see an alteration in posture. So I thought I would show in this particular case the three positions of posture that this person had: first, pre-treatment; secondly, after the massage, just the massage; and then finally, after the exercise. And what I'd like to point out here, in the pre-treatment situation, you could see that the apex of her mid-back is extremely prominent. And the apex sits right here at the mid-thoracic area, which is exactly where the lower trapezius muscle sits. Now, another aspect of what you would see in the posture, the variation to the posture beyond this apex here, is the fact that the upper trap region, that she has actually lost the curvature, the concavity that should be seen in the cervical region has now become convex. And you see that hump situation arise, right? So not only do we see an excessive amount of apex here, how much this is hunched, but we see that the loss of the cervical spine has been achieved, and the head being very far forward to where the ear is in front of the shoulder. So her primary pain was right here. She had had multiple treatments, multiple physicians. This has been going on for years. And that was where her pain existed. Now, as you can see, there's been this alteration of posture. So let's try to explain what caused that alteration of posture. Let me see if we can move this down. So right here, we could actually see that the arrow, this arrow is pointing to exactly where her pain exists. And if you notice that this is part of a continuum, this is one continuous muscle. This is called the trapezius muscle. The arrow is pointing here is the upper trapezius. This is the middle trapezius, and this is the lower trapezius. Now, one of the things I would point out is that the pain she experienced was right here at the point of the arrow. Clearly, that is not on the spine. Oftentimes, people will have pain here, and they will be told that they are having a herniated disc, stenosis, or pinched nerve, creating this pain. Now, how could you irrefutably confirm or refute the diagnosis of a herniated disc if the pain is right here? Well, let's understand the concept. If, in fact, the pain was coming from a disc, that would be to say that the disc is here and it is referring symptoms here. So if I wanted to incite this pain, I would have to press where the disc exists on the spine. So you could press here from here to eternity, and you're never going to cause the pain to refer to here and incite pain here. But if I was to press right here and I could bring the pain on, that would indicate that the place I'm pressing on is the place where the pain exists, and therefore that is not referred pain, but point tender pain. The tissue I'm pressing on is the tissue creating the pain. What tissue am I pressing on right here? It is the lower trapezius muscle right here. So the fact that I could press right at that arrow point and bring on a pain has, without question, irrefutably, there is no denying that that pain could never be coming from a herniated disc. So I don't give a shit if you showed 300 herniated discs showed up on an MRI. That is a baseless diagnosis, a baseless finding. It is completely independent to the fact that the lower trapezius muscle is creating the pain. What is another aspect to confirm that? Well, muscle is responsible for posture, and therefore when I saw that altered posture with the head forward, that would reinforce the point that the pain is most likely coming from a muscle. So let's explain how we got that forward head posture. Well, the lower trap, as you can see, attaches to the shoulder blade and pulls down on the shoulder blade. The fibers attach from the shoulder blade to the lower thoracic spine, all the way down to the rib cage, the bottom of the rib cage. So this muscle would pull the shoulder blade down the back. That's what the lower trap does. It's called a shoulder blade depressor. Now look, your head, your skull is attached to your shoulder blade via the upper trapezius muscle. So if the lower trap was weak, you would not get that downward pull, pulling the shoulder blade down the back, and the shoulder blade might actually begin to rise up the back. Well, since the shoulder blade rises up the back and the upper trap attaches to the skull, if this goes up, the head goes forward, the skull goes forward, right? And we can see, look what happened. The shoulder blade went up the back, the head fell forward because of the fact that the lower trap was weak. And as a result of that, you got this excessive rounding, or it is known as kyphosis, of the upper or middle back, right? So weakness here allowed this to rise, allowed the head to go forward, and as a result, the woman would be looking down. Well, you can't just look down. You would have to look up at a very extreme situation. So all of the motion of the neck is occurring just in the upper cervical spine. This has all gotten lost. You can't go into a concavity here because it's reversed the curve here because of the head moving forward. So this posture is a direct result of weakness of this muscle, allowing the shoulder blade to rise, allowing the head to get drawn forward. Eventually, this strain, because the more the head gets forward, the more it's going to have to work to pull back. So that's why she constantly had pain here. Now, I then went on to do a massage. And what I did was I massaged out the pecs because the head came forward and the shoulders came forward. The pec shortened right here. So what I did was I massaged out the pecs and all the muscles in the front of the neck. That allowed them to become more elongated and had a lesser ability to pull the head forward and the shoulders forward, thereby diminishing the load that the lower trap had to work to pull the shoulder blade down and pull the head back. And what do you see? What is this miraculous change? Look at how the apex of the mid-back has become completely flattened. Look how this excessive rounding here has diminished. Look how the ear was in front of the shoulder and now is over the shoulder. So there has been a massive change in posture and a massive reduction in pain, right where she was complaining of. So that's just by reorganizing the skeletal system from releasing the muscles in the front of the neck and the chest to allow the lower trap to have a greater ability to pull down and pull the head back and reorient the shoulder and reduce the level of rounding or kyphosis of the spine, the thoracic spine. So then we did a series of exercises strengthening muscles in the mid-back region, the posterior thigh, the muscles between the shoulder blades to see exactly what we did. We strengthened the posterior shoulder. We strengthened the mid-traps and rhomboids. We strengthened the lower trap, and we strengthened the long head of the tricep. So I strengthened here, 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 and here. And lo and behold, what did you find? We now pulled the shoulder back even further. And you could see there's an even greater diminishment of the rounding or the curvature, the convexity of the thoracic spine. We noticed that the amount of back that can be seen behind the shoulder has virtually disappeared. We can see that the ear is now centered directly over the shoulder. We can see that the chin has been pulled back and that there's no hanging of the neck in front. So we can see that, as I described, we would want for perfect posture for the shoulder, for the ear to be over the shoulder, over the hip, over the knee. And that's what was accomplished here. So look at this transition of this bad posture to this almost perfect posture, which then allowed the lower trap to not have to work so hard and actually strengthened it so that it could work more effectively, which basically made it work in a way where it wouldn't strain. And therefore, due to that transition of posture and strength, 98% of the pain was resolved in one treatment. This is a physical presentation of a change in posture, which is correlated to the reduction in pain at the muscle group, which was eliciting the pain right here, the lower trapezius muscle. So if you think that you look like this person now, and you would like to look like this person, and you're having pain anywhere from here to here, I would strongly suggest you look to the Yass method to establish the fact that, in fact, the cause of your pain is muscular and which particular muscles are involved, and then get the appropriate treatment to resolve your pain and return you to normal function. You don't have to wait years to get this treatment. It is sitting here. It is available. If you are in the Jacksonville area, Jacksonville, Florida, and you would like to get an in-person session, you can come to my office. Here is the office number, 904-906-YAS, 904-906-YAS. Or if you're out of the area and would like to get a Zoom session, you could go to my website, livewithoutpains.com, livewithoutpains, it's plural.com, and you will see a schedule now button, and you can schedule either the in-person session in Jacksonville, Florida, or the Zoom session on the website, livewithoutpains.com. I would strongly suggest, if you've been in living with pain and you have not found resolution through the medical establishment or any of these alternative types of treatment models that are not identifying muscle as the cause of your pain, this is your chance once and for all to end your pain and live life on your own terms. You can resolve your symptoms and become fully functional and perform optimally, doing the things you love to do when you love to do them under your control. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye.